Welcome to this week's Be Rescued Wellness Show. I almost got our title wrong, Mr. Sadler. Starting out the new year on the wrong foot, as it were. This is the Be Rescued Wellness Show, and yes, we are back from our month-long hiatus. I did not mention a hernia there. I was talking about a time off. We took a break. Much needed break. How were your holidays? Ours were fantastic. Got to spend time with family. It was just wonderful. But we're back, and we are back with a vengeance. We are back to discuss all of those things about health, wellness, and beautiful living. You will note that I am now wearing my fancy schmancy lab coat. That's because I'm filming this in between treating patients in my clinic at the Siloam Center here in Janesville. I am a licensed acupuncturist and a lifelong student of traditional medicine. This is my passion. And so we're going to get down and dirty today talking about what interests me and is important to all of us. And today we're talking about MRSA. Or we've titled this show, The Bad News Boils. I got nothing. Anyway, what is MRSA? What is it? Well, it's often been called and referred to as the flesh-eating bacteria. It was first noticed in 1961 when Staphylococcus aureus, I know I said that wrong, but it's more fun to say it that way, aureus Staphylococcus no longer was responding to methicillin. An antibiotic that had been on the market for about 2 years at that time. Today, the same bug, the same resistant strain of staph is no longer just resistant to methicillin, but it's also showing resistance to penicillin, oxacillin, and amoxicillin, as well as potentially some others. What's frightening about it is in 2011, the year 2011, not too long ago, the CDC says that they have over 80,400 cases of reported MRSA for 2011. Now, that doesn't include the real minor infections. They say there were numerous minor infections, but these were 80,461, to be precise, cases of MRSA that were reported to the CDC. Now, of those 80,461, are you ready? Over 11,000 of those patients would die in 2011 from their MRSA infections. We're talking about a bug with a 14% mortality rate. That's pretty stinking scary if you ask me. One out of every 100 persons is a carrier for this bug. In other words, they're walking petri dishes, usually carrying the bug in the sinuses and the schnoz. And I know schnoz is not necessarily a standardized medical term, but work with me. So they... I'm sorry. It's been a while. I got to get it out of my system. So the carriers, these people, 1 out of every 100 walking around, often have it carried in the nose. They itch their nose, they pick their nose as they're driving or doing whatever, and then they're, touching shopping carts, touching library books, touching doors, touching menus at your restaurant, and then you come along and you sit down and you grab your shopping cart, or you pick it up so many ways. In fact, MRSA is transmitted 2 ways, either person-to-person contact directly from the skin, hey, how you doing? Or indirect contact of, someone else used this teacup before me, now I'm going to use it. We have so much contact with other people, both direct and indirect. Now, the people that are most at risk are those who have compromised immune systems, bodies that can't really fight off the infection in a natural way. Those people would be the elderly, the very young, folks with autoimmune issues, folks with, HIV patients would be very high on that list. It tends to manifest itself on the skin. And according to medicinenet.com, that's kind of fun to say, the signs and symptoms of MRSA are as follows. Cellulitis, boils, abscesses, styes, yeah, it gets up into here, carbuncles, impetigo, rashes, but those are just the external manifestations. The problem is, once it becomes visible on the surface, it's already in the body, coursing around a lot of times, and the body's fighting it in different places, and what can happen is it can get into the organs themselves. And so one of the things that you got to look for is any time that you've got cellulitis on the skin, a boil, an abscess, styes on the eye, carbuncles, impetigo, rashes, any dermal manifestation of disease coupled with fever, chills, low blood pressure, joint pain, severe headaches, shortness of breath, rashes over most of the body, anything presenting in such a way with any of these more internal signs and symptoms, that's when there's cause for great alarm. Now, what happens when you start showing these signs and symptoms? Well, brother, you get yourself to a doctor. You know, what was it? Hamlet said, get thee to a nunnery. No, forget the nunnery. Get thee to a physician. They'll be able to take swabs of the problem area, find out exactly if it is MRSA, find out what strain of MRSA it is, find out what they can use to defeat it. Because you, my friend, are in a battle. You're in a fight for your life at that point. We're dealing with something that is proven to be a killer. What is the prognosis once you get MRSA? Well, it depends on the severity of the infection. If it's a mild infection, it can oftentimes be cleared up. Problem is it moves so rapidly within the body. And so you end up with what looks like a nasty pimple that's not going away, and next you know it's spreading and you've got necrosis of tissue, and it's just, when caught early, it can be treated very easily, which is why we need to keep our eyes open. However, if it gets into the lungs, as in a MRSA pneumonia, that's when it becomes a little bit more difficult to cure. MRSA in the lungs, manifesting as pneumonia, tends to have a 20% mortality rate. Once it gets into the lungs and presents into the lungs, that's when it becomes airborne. When we cough, that's when it becomes very critical for any healthcare practitioner, any caregiver, to be wearing a mask. MRSA, I am your patient's physician. That sort of thing. Forgive me. I get carried away. How do you prevent MRSA? Number one way to prevent it. I'm in the Midwest. Remember, I'm about to tell you what I'm doing here. Wash your hands. For everywhere else in the country, the number one way to prevent MRSA is to wash your hands. Get it? Wash. Wash your hands. This hand washing is key to prevention of most diseases. And so when you have it on your hands, living there saying, oh, let's wait for somewhere to get into the skin, and you've got a little scratch up here, and your fingernail breaks the surface of the skin, and the bacteria that's how it gets spread. Or you've got a little bit on your hand because you might have had a boil back here and you might have touched it, or you might have been touching that shopping cart, and then you shake hands with someone at church or at work, and suddenly you've spread that bacteria. So wash your hands. The other way to do it is to keep antimicrobial wipes handy. Wash the handle of your shopping cart down. Wash your table when you're at a restaurant. Wash after handling the menus. You know they don't clean those menus, if at all. After handling the menu, go wash your hands. If you're in the Midwest, wash your hands. Treat any breaks in the skin very seriously, because you don't want even slight breaks. Little fight bite right there. You don't want any breaks in the skin to get infected. So you want to make sure that you're treating them. I'm treating that with some propolis. The other thing you want to do is prevent cracking of skin. This time of year, skin cracks are hands cracking. It's just rampant. You got people coming in all the time saying, "What can I do for my dry, cracked hands?" One of the best things to do for them is to keep them moisturized. If your hands are cracked, put this stuff on it. It's going to heal those dry, chapped, cracked skin. Help prevent the internalize of having infections come into the body. If you don't have dry, cracked skin, then maintain your good skin with the hand lotion. Either way, the Be Rescued Propolis Care is going to be the best material to put on your skin for moisturizing and keeping your skin healthy. If you do get the infection, number one, get checked out by a doctor as fast as you can. He's going to be able to take swabs, do lab analysis, determine what kind of prescriptions that they can get you on that will be effective in killing this bacteria. I'm an acupuncturist. I can't do that. If you come into my clinic and I am suspecting something, I'm going to say, get thee to a physician. Once your physician has come up with a protocol on how to treat it, that's when you can then, number one, follow through on what your physician is telling you to do. Number two, you can partner with your physician, and you can include such things like a garlic bath or a tea tree oil bath, or putting propolis on affected areas. Chinese herbs have been used for centuries for patterns that are similar to MRSA. Notice I said similar to. There have been bacterial infections manifesting in the skin since the beginning. But one of the herbal formulas that comes to mind would be Longdan Shegantan, which is an herb for clearing toxic heat of the blood, which is what we would consider in Chinese medicine to be the problem, the root cause of that MRSA. Taking things like turmeric, which is another herb that's out there, often used as a spice. It's great for killing inflammation within the body, including inflammation of the skin, which would be these MRSA infections. Regardless of if you go straight pharmaceutical, which is fine, or if you decide to help boost that pharmaceutical, the work of your doctor with some of these other modalities that I've mentioned, regardless of what you do, get yourself some sleep. Okay? And this is where I would come in, someone of my profession. We're great at helping you to sleep. Get thee to an acupuncturist, get thee to an herbalist that can get you some herbs to help you sleep. Even, I'm not a great proponent of pharmaceuticals, but if you're in one of these cases, talk to your doctor. Maybe he can get you some trazodone or something to help you sleep. The idea is get yourself rest so that your immune system can be pumped up and so that your immune system can knock out this bug. MRSA is a very dangerous infection, and it's becoming more and more popular. More and more. Everybody's doing it. Woohoo! It's becoming more and more commonplace. Take the steps to avoid it. If you're given an antibiotic for something by your doctor, use that antibiotic as prescribed. Don't stop early. Don't dabble with it. Do what you're supposed to do with it. Do what you're told to do with that prescription. Otherwise, you are creating a perfect storm of events within your body. If you do get infected, work with your doctor to kill that infection. Keep your immune system strong so that you can fight off the infection before it becomes a problem. Make sure that you're taking things like pollen. Remember old Hippocrates said, let your food be the medicine. Let thy food be your medicine. You know what he said. Let thy food be thy medicine. I'm getting confused with my homespun eloquence and my ancient English. Hippocrates said, let thy food be thy medicine. one of the ways that you can boost your immune system is by making sure that you're taking bee pollen on a regular basis. It becomes very, very important to helping the body stay strong and healthy. Well, any manifestation on the skin of anything that we discussed before, any cellulitis, any boils, abscesses, styes, carbuncles, furuncles, ants, impetigo rashes, that was a joke, the ants part, or aunts if you're from the Northeast. Anything like that showing up on the skin, have it checked out by a physician. They need to take a culture. They need to find out exactly what they're dealing with. Until next week, y'all remember to laugh, love, and be well. Thank you.